And he asked me like, how would I trust you? Like, I know you're a good physician, but there's a lot of things in the background that I'm not sure if I can trust. Sometimes doctors think that just by being a doctor or a researcher, that will give you enough trust with the patients, and they don't necessarily trust you because you gave them the right medication for their blood pressure or not. They trust you because you're there to listen. They trust you because you acknowledge their challenges. One of these times in my career where this really showed up was during the COVID pandemic. The pandemic, I think, all the conversations that I had to have about vaccines with patients that had a lot of mistrust with really good reasons. I remember I had this patient that he had a lot of worries about the vaccine. He was a patient coming from a community of color, and he was worried about all these injustices and oppression from medicine and from research in the past to communities of color. And he asked me like, how would I trust you? Like, I know you're a good physician, but there's a lot of things in the background that I'm not sure if I can trust. And it took 6 or 7 visits of talking about this. I'm putting like those 2 or 3 minutes in my visit to talk about this again, and listen to him and acknowledge these things, acknowledge that yes, like medicine has also caused a lot of damage to communities of color, until one day he came and he told me like, I'm ready. I think we've discussed and now I can understand what their risks. I think there's benefits for me and there's benefits for my community if I take the vaccine, and he was able to do that. And I think that was a key moment for me in terms of how much patients and how much this is about sharing their patients' stories and their patients' lives more than kind of telling them what you think is right. And this is something that is not necessarily a skill that they teach us in med school. It's a skill that you kind of learn by providing care to communities of color. And what I've found that the most effective thing is to making sure that you acknowledge that their struggles are not their fault, that their struggle comes from racist policies, that their struggle comes from xenophobia, that their struggle is not because they're not working hard enough. So before I give any recommendation or I do anything, I put that out on the table. Even when we're talking about vaccines or other things, I put it on the table that there has been a lot of oppression to communities of color in general by our profession. And I think this also comes from my experience as a patient. I've had health issues, and whenever I go to the doctor, I'm like hyper aware of these things. Also because this is something that I'm very passionate about in terms of how you communicate with patients. And so one of the things I do before I go into the room, I just pause, take a deep breath, to try to also calm down all that crazy rhythm that the current health system pushes us to be like running from one patient to the other. Take a deep breath, go in, like try to slow down, sit down, and I really greet the patients, and I always ask them how's life. I just ask them how's life, and to give them that space for them to really think of how's life, and they might want to share something about their family, and I just give them that space. I've also stopped using, like for my outpatient clinic, I've stopped using my white coat because I think it creates that power dynamic, right? Like I'm the doctor, I'm wearing the white coat, and I'm putting myself there. So taking that out and just wearing regular clothes. But I think that the key point, if I can identify something, is being aware and accepting that the power dynamic is there, and to be able to provide care to marginalized communities and communities of color, you need to do something about it, because if not, you're not going to be successful.